Ever wondered how a simple tube can save a life? The insertion of an IV cannula is a core skill that every medical professional must master. Cannulas come in various sizes, each color-coded for specific uses, from infusing medications to administering blood products. Before starting, introduce yourself to the patient, explain the procedure, and gain their consent. It's crucial to ensure they understand and are comfortable. Gather all necessary equipment: alcohol cleanser, gloves, an alcohol wipe, a tourniquet, an IV cannula, a plaster, a syringe, saline, and a clinical waste bin. Sanitize your hands thoroughly using alcohol cleanser to maintain a sterile environment. Position the patient's arm comfortably and identify a suitable vein for cannulation. Apply the tourniquet, recheck the vein, and clean the patient's skin with an alcohol wipe. Let it dry completely. Insert the needle bevel upwards at about 30 degrees. Once you see a flashback of blood, advance the cannula further into the vein. Remove the cannula from its packaging, ensuring not to touch the needle, and prepare the patient for a sharp scratch. Release the tourniquet. Apply pressure to the vein. Remove the needle and secure the cannula with a plaster. Check the saline for patency and ensure the patient is comfortable.